This episode of the ZuLoo Poodcast is sponsored by ZuLoo Inc., a benefit corporation dedicated to the goal of universal access to toilets, hygiene, clean water and sanitation through the power of social enterprise. Learn more at ZuLoo.com.
Yeah, other things in the news. Speaking of which, I have to go to the bathroom. Time out.
Oh, okay.
It's funny. He's talking about it. I'm like, I think I've got to go.
Darren does not have the syndrome.
Sorry.
That's amazing.
He's not joking. Okay.
You can keep it rolling.
Keep it rolling.
Welcome to the ZuLoo Poodcast, where we talk all things poop, toilets, and sanitation. Through insightful news, impact stories, and quirky humour, we aim to discuss and highlight the critical role toilets play in whisking poop out of our lives, the impact toilets have, or lack thereof, in the health and wellness of humanity, and what ZuLoo is doing to help solve the current global sanitation crisis.
Hey everyone, welcome to another episode of the ZuLoo Poodcast. Today we are sitting down with our friend Jennifer McWilliams from the FSMA, which stands for the Fecal Sludge Management Alliance. We're going to get into exactly what that means,
Fecal
how you
sludge.
or how you manage it. There was a lot there. She was a blast to talk with.
She's so knowledgeable.
Very knowledgeable,
plethora
really
of knowledge.
friendly, has worked in a lot of different spaces, worked on with the Bill and Melinda Gates Foundation. She was a joy to talk to and taught us a lot. It was really, really fun. So I'm excited to get into that interview. Again, we're so happy to have Suzanne here with us.
Thank you. Happy to be here.
World correspondent.
Yeah.
That's right.
Oh, yeah.
But before we get into our interview, of course, we've got some Poo-News to chat about. So, Darren,
We got to
over to you.
Cover the Poo-News.
Yeah.
This new term, you've probably heard about it, bowel shyness. Is this something that affects
Bowel
you?
shyness.
Wow.
Jocelyn,
I've
does
heard
this
it
affect you?
as foreign toilet syndrome. Is that the same thing?
Yeah, possibly.
I have not heard of this term. I am learning a lot.
Are you too shy to poo at work or in public settings, especially when there's maybe coworkers that may come into the bathroom as well? It's a thing, you know.
So
I think we all kind of,
I'm sure there's like a spectrum here,
right?
but I feel like the height of this for me was when I was dating a lot and I was so afraid of going in someone else's house. So I would make sure that I went in a public space so that I wouldn't have to worry about it
Going while
That's
you're
later.
there.
smart
Yes,
thinking,
yes.
right?
So I had the
That's
opposite
true.
problem. I never wanted to do it in private. I always tried to do it in public because there's like 4 stalls. No one knows what happened to you, what
Right.
you did in there. So there's
true.
some
Good
anonymity
strategy,
in a public
right?
space.
Okay.
Yeah.
It is
It's a
true.
good
There's some
strategy.
anonymity, but if it's
Right.
especially if it's a small office, right? And there's only a handful that people can do the math, like, who left for 5 minutes and what happened to the toilet in the meantime, right? They can pin it on you a little more easily. So, yeah, so you might be a little more shy, but some people aren't shy. You know, they're like, I just go to the bathroom.
This
Where do you fall on that spectrum, Jocelyn? Are you sort of like,
I wish
who cares what you think?
I wish I could
don't
be
know.
more of a who cares. Like we all
Right.
do this. What is the big deal?
right?
But no, I'd say yes. I have some.
What is
So
it?
bowel
again?
shyness?
Bowel shyness.
Can it also be
Bowel
bladder
shyness.
shyness, or does this
It could
specifically?
be bladder shyness, you know, just toilet
I don't
shyness.
think
What was the term you
bladder's
said?
quite as much.
Foreign toilet syndrome, which is like if you're
Foreign
not on
toilet.
your own toilet,
Oh, yeah.
you can't go, which is a little bit different, I think.
Okay.
It's a little different. It's more of a germ thing.
Yeah.
This is more of a social, like, I don't want
don't
other
want
people to
people to-
know what I'm
Mhm.
doing, going to the bathroom. Right?
This does make me think of a gentleman that I knew in Florida, which I won't anyway. Like
We're not going to out this guy.
Yeah. Well, it was his wife. Whenever they traveled, like they lived in Florida, but they lived in New York. But she would never, ever, ever go in a public bathroom. Like she just wouldn't. And so it really impeded them when they traveled. Because he told me this story and I was kind of like, and he's like, no, he goes, you talk to my friends. It's a real thing. We either have to backtrack and go to our house or we have to I have to go negotiate that she can go like in a hotel or something because she wouldn't go like in a gas station
So
or whatever.
That's extreme
yes,
for it.
Very extreme. And I was like, wow, that's talk about high maintenance.
Yeah.
So there are things out there, right?
Yeah. I know.
Yeah. So it could affect your ability to work. Like if you, maybe you don't eat, or maybe you're instead of going using the restroom at work, or you go down the street to the toilet, a public place. So,
or you maybe go to the office downstairs and just
blame it on them.
Like go down, so that your coworkers.
It's so funny. Like the lengths we'll go to avoid letting other people know that we are human and have this need. It's
right.
Psychologically, going to the bathroom shouldn't be
I know,
big of a fiasco, but it is.
We all do it. Everyone, no matter how old.
And if you don't, there's something wrong with you. Like,
yeah.
Then you're having the other problem.
Yeah.
They say nervousness and stress can have a huge impact on everyone's gut. Those with genetic predispositions or sensitive gut will react differently and more severely compared to those with a normal gut. Like you can't in other words, don't try to some people they'll try to again go without eating or go. It affects their system, right? Mm-hmm. Just because they're anxious about other people knowing about it, right? So, anyway, it has some tips here. How do you help? How do you help with a shy bowel disorder? It's funny they call it a disorder. I don't know if it's a disorder. It's probably all of us have it to some extent, but they do have some tips here, like distracting yourself. You do some breath work.
Like
take deep breaths
before you go,
relax. Use the toilet roll sparingly. I don't know.
Wow, David. I do some breath work. That could be counteract because then you do that before you get in. Yeah, here's the tip: do that before, not while you're going to number 2.
Anyway, so I don't know if it's a true blown disorder, but it is a thing, right?
I empathize with people on that spectrum. I think I'm on there, just not at the extreme end, which is weird because we have talked about wild toileting, which I thought meant perfecting the art of going in the wild.
Yeah.
And I feel like I've done that.
Right. Oh, you perfected that one.
Yeah, I think that's way easier than going in somene's house.
Or going on the streets of London or New York.
Yeah,
or
no. That's too much.
Other things in the news. Speaking of which, I have to go to the bathroom. Time out.
Oh, okay.
It's funny. Talking about it, I'm like, I think I've got to go.
Darren does not have the syndrome.
Sorry.
That's amazing.
He's not joking. Okay.
You can keep it rolling.
Okay. Keep it rolling.
Okay, like I said, we're all human. It happens to all of us.
Exactly.
And you never know when it's going to strike.
Right.
So this is a safe space.
We did eat right before we came, so it's hitting him now. I mean, this is...
And we were talking about fecal sludge.
Ew,
I mean, that's
gonna...
Okay, well, I think we're ready to jump into the interview with Jennifer. I think you guys are really going to enjoy it. Jennifer was warm and fun. And like we said, she's a real expert in this area. And I'll tell you some of my favorite highlights from the interview when we get back. Okay, everyone, we are so excited to welcome our guest, Jennifer Williams, to the show. Jennifer is the executive director of the FSM Alliance. We're going to ask her all about that, what her organization does. But Jennifer, I'd like to just kind of start with getting to know you. Tell us a little bit about yourself, where you're from, and how you got involved in sanitation.
Yeah, so I'm originally from the U.S. I'm living in the Netherlands now. Grew up in Seattle and kind of got into NGO philanthropy at an early age. Was really focused initially on wanting to focus on HIV. So I had always said that my dream job was to be on the HIV team at the Bill and Melinda Gates Foundation. And lo and behold, in around 2011, I applied for a job, which ended up being a temporary position at the Bill and Melinda Gates Foundation. But unfortunately, not on the HIV team, but on the water, sanitation, and hygiene team. So I joined that team with still the hopes that I would eventually move to HIV. But then, for better or for worse, caught the toilet bug when I joined with the the sanitation team. So
a different virus, right? It's a different
virus. Yeah, different. Yeah. And so joined them.
We're glad you did. We're glad you got bit by that one.
Yeah. It's much more interesting. Yeah.
Cool.
And worked there for 7 years, and was really looking to try to figure out what my next career move was, and then became involved in planning what is now known as the FSM conference, or the Fecal Sludge Management Conference. And that led to an opportunity to start this new NGO that's based in Europe. So that's how I became the executive director here. And so the organization was really, it really grew out of that conference. The conference started in 2011 in Durban, South Africa. And it was really a conversation for people to talk about, what do we do now that the pit is full? Because they built all these pits. And it's interesting that no one really thought about, what are we going to do when they get full? And so they had a small meeting there. They had another one in 2012, and then it sort of grew from there. And by the time it was 2015 in Vietnam, it was 500 people, I think, roughly. And then I became involved in 2017 for the fourth version of this conference in India. And then also was asked to help work on the fifth one. And it was after the fifth conference, which was in Cape Town, South Africa, that I transitioned full time to be the executive director. And when the organization really was finally established and formalized. And then we went through the process of what other things should the organization be working on. And one of the big things that we found was a lot of people working on non-sewer sanitation or fecal sludge management were feeling quite isolated, and they didn't know how to connect with their peers and network, because it was, especially at that time, a fairly niche topic, and it was a little bit lonely and not something you can necessarily come home and talk about over dinner.
I don't know, fecal sludge management. Sounds pretty interesting.
Not everyone wants to talk about it while they're eating.
Just the word sludge and fecal together.
When I first read that, I was like, maybe think about rebranding, but maybe not. I don't know.
We've had the conversation, and it's always a little funny. There's always the purists that want to make sure, we need to be explicit. We need to say it in the name, and we don't want the message to get diluted, and we need to stay focused on it. And then there's others that are sort of don't want to say it, and you can kind of tell. And it's always a little funny to me when I meet new people and they say, "I'm sorry, where do you work?" And then they don't want to repeat the word fecal. For which is, I think, one of the reasons sanitation is still such a big problem, is there's a lot of taboos around it. So people don't want to talk about it. And for those of us who are connected to a well-managed sewer, we can sort of flush and forget, and things happen. And we don't know. And it works. We pay the bill. It works, right? Yeah.
So the term fecal sludge, I mean, we've had some people on the show, Ocean Sewage Alliance, and some other very highly more educated people than we are. But fecal sludge is a very specific thing. Could you maybe elaborate on that? I mean, I think the term fecal sludge is a technical term, and a lot of people don't. They kind of know what feces is and maybe sludge, but I mean, what is it exactly?
It's really the mixture of what happens when it leaves the human body and how it ends up, and it sort of kicks off a specific process, different various types of digestion that can happen either naturally or accelerated naturally or through other types of treatment. I'm not that technical, actually, so you may need to come back to you on that. I work with a lot of.
It's basically poop or shit. It's that, right? It is that. It is.
Yeah.
And then of course,
we don't need to be super technical.
how do you manage it? Yeah, obviously. Okay, now that it's out and we have it, now it's.
What do we do?
This is it, right? What do we do with it at this point?
What do we do with it? Yeah.
Yeah. Okay.
And
got it.
When the pit gets full, what do we do with it? Yeah.
Right.
There were a lot of pit latrines built without really thinking through, what are we going to do with it when it gets full? Yeah.
Right. True.
And for people who maybe aren't familiar with that term, it literally is just a big pit, and how does all the sludge get there? Is it carried there, or are people delivering it there directly, or how does that work?
It depends on the type. There's different variations. So usually you have sometimes it can just be a hole in the ground. Sometimes there's boards put on top so that there's a place for people to sort of stand or squat usually, depending on where you are. Sometimes they have a what would we call it? Like a plastic overlay that helps you not fall in, because that is a problem in places where they dig the pits really deeply. They're obviously difficult to empty. And so some people have actually died from trying to empty really deep pits because they fall in and then they can't get out and can't call for help. And then in the most
your worst nightmare, right?
Yeah. In the most sort of horrific death I can possibly maybe imagine, they drown in the pit latrine. So, and so it's a problem. A lot of in some countries they just tried to dig the pit as deep as possible, so it never had to be emptied. That was one strategy. But it is a really hazardous. Yeah, it's really dangerous. And there's also because as poop starts to degrade, it lets off gas that it can be poisonous. And so there has also been a few where they've gone in to empty the pit latrine. They've been rendered unconscious because of the fumes, and then have almost died. Yeah. So it's dangerous, and it's a problem. I think that the concept of we need to at least capture it was a good one, but it led to a lot of unintended consequences. Yeah.
I was reading on your site about these, just on the topic of pit latrines and emptying them, you have these pit emptying challenges. So tell us more about that, because it almost sounds like some kind of like a competition, but the workers are also learning new skills and making sure that there are some standards in place to make sure that it's done safely.
Yeah, so we created the challenge originally to try to help raise the profile of sanitation workers. So a lot of the pit emptiers in various countries are fairly ostracized or stigmatized, because again, there is this taboo around, you work with poop, so therefore you're unclean, or you don't have the skills to do something else, and so they are often marginalized. And so, and tend to be kind of in lower income. So we decided to create the challenges, one, to educate people on what really happens and the work that goes into emptying them. Even for people that use them, sometimes they're not familiar with what happens in the challenges to empty them, but also to help bring more respect and dignity to the people doing this. Is a vital service they're providing to the community. And so to try to bring some of that recognition and show that it is a skill. And we actually had some plans to try to bring this to the World Skills Challenge. So they do all kinds of different, kind of like the Olympics for trade. So bricklaying, hair cutting, some of those really more skill-based trades. And so they have competitions kind of like the Olympics. And so that was our idea, was let's educate people, but do it in a fun, approachable way. But also let's bring some more dignity and respect to the people that are actually doing this work as well, and make them feel like they are valued and seen. And so that was started in Cape Town, actually. And then because our 2021 conference had to be online virtual, we did video submissions. And so those are all available on our YouTube channel. And then we were able to do another in-person one at our most recent conference, which was jointly co-organized with the African Water and Sanitation Association, which is the association for all African utilities. And so we had, I think, 7 different teams represented from 7 different countries competing in the challenge there. But yeah, the focus is on doing it safely. Pit emptying is actually quite dangerous because in places where there's not good solid waste management or trash management, you often end up with a lot of trash in the pit latrine as well. And some of it can be dangerous, broken glass, needles, all kinds of things end up there. snakes, hair extensions, plastic bags, all kinds of interesting things. And so we want to promote safety for them and how to wear the proper protective gear, and then making sure, because the material that they're emptying can sometimes have diseases in it. So making sure that they're not contaminating the environment when they're extracting it, so no one else gets sick. And then, a secondary piece of this is also making sure that once it's actually removed from the pit latrine, it does get treated safely and properly. We know a lot of different bad bugs live in fecal sludge. So we want to, cholera, E. coli, all of those kinds of things. It's really important that gets treated in a safe way. Unfortunately, one of the common practices is to illegally dump it in rivers or lakes, which ends up usually contaminating water supply. So you end up with this, people get sick, and then it's kind of this circular, not the circular economy we like to talk about. Yeah.
Yeah. I was going to ask you, certainly the actual pit latrines that are most common in most countries, those are dangerous in and of themselves. But then it seems like the next stage is when they do fill up, or when they do, like say for, like in Nigeria, last year we had tons of flooding, right?
Yep.
And so I imagine you could envision all of those pit latrines being overflowed or,
Yep.
going downstream into water supplies and all of that. So is that part of also fecal sludge management? Is that also something you focus on?
It is. So we talk about an entire sanitation chain. So making sure that everything is safely managed from what we call containment. So when you go to the bathroom in a toilet, making sure it's contained in a way that is not going to contaminate the environment, all the way to hopefully it being treated and disposed of properly. Mm-hmm. And we would argue hopefully also it's treated in a way that it can produce a value product, whether that's fertilizer or various other things, that it goes the whole way. So it is a little bit more complicated to implement because it's decentralized, and right now it's currently fairly unregulated and informal. So we definitely have some ideas on how we could develop more standards on how to do things safer, and that would allow it to be more easily adopted as well, because there would be clear requirements in place that could say, if you build the system this way, you can ensure safety.
Mm-hmm. So you are like trying to focus on building, or I guess replacing these sort of, basic systems, which obviously a pit latrine is better than nothing, right? But certainly it has all the negative drawbacks we just talked about. Are you involved in helping communities like replace those with newer or more innovative technologies? Is that also something you guys are doing?
Yeah, I would say that we are more trying to influence decision makers to look at non-sewer sanitation options and then providing them with the information of what's out there. So really trying to influence more at a governmental, municipality, systems change level, and less specifically on an individual community. We don't do any direct project implementation ourselves. We try to be more of a facilitator and a connector, hence the membership network that we've created, to really try to say, if you need an expert in this, we have a whole list of people that are working in this that we can point you to the right direction. We can point you to the latest technology, the latest solutions, the latest approach, but really trying to bridge that gap, because I think one of the other guests you had on your podcast, Berger, he talked about there's a lot of talk, there's a lot of reports, but if the reports don't get to the right people in a way that you can comprehend them, because let's be honest, who reads 30-page reports anymore? So really just trying to connect connect people to the right resources, I would say is our main, while also spreading awareness and managing the conference. Yeah.
So you're emailing them ZuLoo's website constantly.
Of course. Yes.
Okay, good.
Yeah.
I did have a question, and I'm coming at this from what I'm guessing is most people's perspective in the US, where we flush it and forget it. And so we aren't aware of, FSM, this management of what leaves our bodies. What is the best case scenario with a pit latrine? You mentioned fertilizer, but what are some of the other solutions for that? Because there are so many of these in place already. It's wonderful if we can replace these with more advanced and safe systems. But what is the best case scenario with those that are already in place?
I think the best case scenario we would see one, just changing the mindset and just realizing that it is a problem. And, for a long time, for many countries that didn't have full sewer system coverage, it was still considered the gold standard. And so I think part of our advocacy work is really trying to say, there's other options out there. And really, if you think about the sewer system is 200-year-old technology. So that is the equivalent of, and I'm going to age myself quickly, is the equivalent of still operating on Windows DOS. Yeah. Or the original iPhone for the people that don't remember DOS. And so if you kind of think about that seems crazy, right? Why have we not changed? And so even in major cities, the infrastructure is old, it's aging. And the other thing that we don't really talk about is how are we going to replace it and fix it? Mm-hmm. Because in order to fix pipes that are leaking, you have to be able to identify where the leaks are. Most of the treatment plants that power our systems in the US or even in Europe are actually at capacity. Mm-hmm. So if you have places with population growth, there's no more land to expand. It's really hard to find new land. And what are you going to do? Are you going to dig up all the pipes in London to replace them? No, that's not possible. Yeah. And I think it's something that we're not talking about in North America and in Europe. Seattle a couple of years ago had a catastrophic failure at their major wastewater treatment plant, and that really meant they dumped untreated sewage into Puget Sound for months until they could get back online. And I'm not.
I heard about that.
Yeah, it was bad because some sensors failed, and the whole plant flooded, and some people almost were seriously injured. Yeah. So employees at the plant. So I think it's really aging technology, and we just haven't had the conversation of we need to pivot in the same way that we're pivoting to green energy. It's the same thing in sanitation, and I think sanitation's been a little bit isolated and not very publicly spoken about. So we haven't been able to talk about it openly and address it.
Yeah, well, I totally agree. We're taking Victorian era, 18th century technology, right? And we're trying to bring it into the 21st century, and it's expensive and it's not super effective, especially when you see these kind of issues. Even if you were to, hey, let's build wastewater treatment plants everywhere, after a while they're going to be, I think we definitely have to look at things. Going back, you were talking about the Bill and Melinda Gates Foundation, the whole, reinventing the toilet. Mm-hmm. We followed that really closely and super excited about it, but it seems like it was like one part of the whole issue is, the user interface, the toilet. Obviously that can be revised, but then if you have to look at the entire system, like, well, where, do you connect it to a sewer system, or do you not, or is there something better? And we've been really excited and fortunate to have a lot of innovators like yourself on the show talking about what does that future look like. What does the future look like, Jennifer? What do you see?
Yeah, I think in my
good or bad future.
Yeah, in my opinion, it's a little controversial. We do need to move to decentralized non-sewer treatment and do build different options that are smaller scale, more community size, that can fit in places where land is restrictive, and really looking at how can we extract value products. So, sorry, Jocelyn, you asked me the question, then we drifted off to another topic. But there are certain places where there's a lot of water, where you use water for cleaning instead of toilet paper for wiping. So, if we can recapture some of that water, clean it, the water can be used also for agricultural purposes, for watering lawns. It can also be used for coolant in some instances. So it just depends on how we start to think about, if we start thinking about our own waste in a different way and looking at it more at the value that it can bring and where it can kind of be reused. I think that's a big key step. But I do think that the future would be no one would be connected to a sewer system, and we would have lots of different types of technology out there. I think it's been fairly easy to just focus on one. But like I said, they're aging, and there's no real viable way to fix them. Yeah. Mm-hmm. And if you think about it, really the sewer system was invented to help the cholera outbreaks, by a different Jon Snow than Game of Thrones. Yeah. Not that Jon Snow, a different one. Yeah. Yeah. But he began to realize that people were getting sick from cholera because they were drinking contaminated water. So, Darren, just like you were mentioning, when there's a lot of flooding, where there's a lot of pit latrines, that's where you tend to see cholera outbreaks.
Mm-hmm.
Yeah.
It feels so overwhelming. Like it almost seems like the problem is too big. We've let it go too long. We haven't kept up with our own, the population growth. Tell us some of the victories that you guys have had in your work. Give us some hope and let us know that there are really smart people on this job.
There are really smart people on it. And I think it's been good to see the focus on this in sort of the last 10 years, even the changes that I've seen about shifting attitudes. And there's a lot of people that say the first step is admitting there is a problem, right? Mm-hmm. So we're finally seeing that happen. And I think so lots of different new technology coming out, new approaches, which is what our conference aims to do. And I think we're just fresh off of the 7th iteration of that, which we co-hosted in Abidjan with FSMA that I mentioned, and really bringing awareness to all of the African utilities of sort of, you have an opportunity to leapfrog over the sewer system and avoid that, and really try to put in the newest, latest thing, and learn a lot of lessons from places that are seeing how the sewer system is no longer meeting the needs of the people. And so how can we move past that? And I think that's where we're seeing some really excitement. Sanitation people are some of the most dedicated, passionate, committed people who will, work around the clock to try to solve this. And so I think what'll be interesting now, and what I'm most excited about, is starting to talk about water, sanitation, and how that impacts climate change, and how this needs to be more. We need to be looking at everything more holistically and more integrated, because trying to solve things as a siloed issue, I don't think has served us well. And so that was the main outcome of the conference that we just had in February, was really because of the partners that were involved. It brought together the water and sanitation and non-sewer sanitation. It brought everybody together in a room in the way that I hadn't seen it, because before there's a water conference and then there's a sanitation conference, and everything's very divided. So I thought that was really encouraging. I think what is also really encouraging, which I hope you guys feel too, is the younger generation are not interested in repeating mistakes of the past. And so I think for all of the people who are just entering their careers with new ideas and can clearly see and feel the mistakes of the past, I'm really inspired by them. Suzanne mentioned it on one of the other podcasts about Nigeria, the young entrepreneurs that started the shoe polish company. Just really, really impressed by them, saw them as well. And just, the way that their thinking about problems is so different. And so that's what I think is really, really gives me optimism. And so what we can try to do to help, mentor and grow young professionals and give them some space to be seen and to be heard, I think is one of the things that keeps me inspired. Yeah.
That's awesome.
Sorry, go ahead, Jen.
Go ahead.
I was just going to say, I think there's this pervasive idea that the sanitation crisis exists outside of the States. Like, this is not a problem for us. Our sewers are fine. We flush it. We don't have to think about it. It gets sent to the professionals at the water treatment plant and we're all good. But I mean, you touched on it a little bit. All of our infrastructure is outdated. It's not going to last. And we have to come up with new solutions. And this idea of non-sewered sanitation, I think that is such a big paradigm shift.
Yes.
And like, as you're speaking, I'm like hearing it in a different way and thinking about it in a different way. So people listening, the future is not sewers. That's such
a problem in the U.S. Yeah. Certain communities, particularly in rural parts of the country, outside of major metropolitan areas, it is definitely a problem. Yeah.
Mm-hmm. Yeah, I think that is going to be kind of like grinding the wheels in our brains to see this in a much different way. And if we don't, it may happen in our lifetime, but our children and our grandchildren will definitely suffer the consequences of that. So I think that that term non-sewered sanitation has really stood out to me as we've been talking. And it's exciting to hear that the younger people that haven't been around to, have lived with this system forever and think it's the end all be all are saying, hey, it actually isn't. And here are some things that we're working on. That's very inspiring.
Yeah, Jennifer, we only have a few minutes left. And you've worked around the world now, several different countries. What's been the most interesting experience that you've either seen or observed in your travels?
Most interesting in travels. Oh, that's hard. That's hard.
Do you mean like toilet related or how specific?
Toilet related.
Well, we're talking about toilets, so yeah.
Okay.
Yeah. I mean, I guess what was most eye-opening as someone who grew up in the Seattle area was not everyone goes to the bathroom in the same way. So the very first time that I had to use a squat toilet, I didn't know it was going to be my very first time, and it was actually in China. And it was a little bit like, I don't know how to do this. I don't know where to stand. And I was fortunately, I guess, wearing a dress. So that eliminated some challenges, but I was wearing wedge heels. And all I could think was, please don't fall over.
Don't get on the heels.
Please don't fall over. I don't want to fall over. I don't want to fall over in the squat toilet because, well, I don't want to fall over. So it was this like, and there's nothing to hold on to. And in Chinese public toilets, usually the toilet paper is dispensed at a central location outside of the stall. So if you don't know that, helpful tip to anyone traveling in rural China, check for the toilet paper before you get into the stall and sort of get situated, because when you don't, you sort of end up without any, and there's not any in the individual stall. And so that was probably the most eye-opening was, everybody doesn't go to the bathroom the same way that I thought that we did. And some people squat and some people sit and some people wash and some people wipe. And there's a lot of different practice around it, which is just something I'd never thought about before. But it is something you need to think about when you're designing different user interfaces and technological solutions, because like I said, it varies. And this is also why sometimes if you have a pedestal toilet, you'll see signs where it says don't squat on the pedestal toilet, because, there's all these, it's dangerous. You can fall off, but also it can break the toilet. So just, whether
I've seen those signs and it's like, how do you even, how would you have the balance to even?
Exactly. Yeah. And who wants to fall in a toilet stall? No one. No one wants to fall.
Those squat toilets do exist in the States. I just took my girls down to Arches National Park, and it was their first experience with a squat toilet in the park. And so
I've never seen one in a squat toilet.
I hadn't either.
In a park. I've never seen one either. That's wow.
Yeah, they had a toilet, and then they had they had both. And my girls were confused, but it was great because we could have this conversation about there's lots of different ways to skin a cat here. And here you have two options.
Yeah.
Well, I'm glad the Park Service had that ability. I mean, they have a lot of international visitors, so I'm sure that was something that...
Yeah.
Maybe people were squatting on the pedestal ones and they kept freaking.
I know.
So they
You never know.
Yeah.
Somebody must have been doing it. Otherwise, they wouldn't have made that little sign. Don't do this.
Yeah.
Awesome.
Well, Jennifer, it has been a pleasure talking with you. If any of our listeners want to get involved or learn more about FSM Alliance, where can they go? What can they do?
Yeah, they can visit our website, and we couldn't buy the domain that we wanted. So it's fsm-alliance.org, not fsma.org. It could take you somewhere else. And I highly encourage everybody to visit the YouTube channel on the pit emptying videos to really get a different sense. There were 20 different videos from 20 different teams from various places around the world. And even seeing how they approach things differently was also really interesting for me. So highly encourage everybody to learn a little bit more about pit emptying. Yeah.
I hope that tradition continues. I think that's a really clever and smart way to elevate this job that is so necessary and does not get the respect that it deserves. So good for you guys for making that happen. That's fantastic.
Thanks for having me. Really appreciate it.
Thank you.
Hey, Jennifer, we'll be in touch. Thanks so much.
Thank you. You guys have a good day.
Okay, bye.
Bye.
Welcome back, Darren. Everything okay?
Yeah.
Yes. I apologize about that. That was not planned. I did not plan that.
It really wasn't. It really wasn't. We were just so shocked.
I think it was.
I was like, you know how that kind of that urge comes along, and then you're like, I think I'm okay. I can get through this podcast, but then I'm like, nope.
Your body has other plans.
No.
Yep. Yeah. Mm-hmm.
And so all this talk of bowel shyness kind of triggered me, You
had the opposite response.
I got the opposite trigger.
You got bowel aggressive.
Right.
I got bowel aggressive. My bowel was like, I'll tell you who's in charge right now. So sorry, missed, the interview sounded like it. Well, I was there, but it was great.
It was great. Jennifer was a blast, defining for us exactly what fecal sludge management was and what goes into it. I really, really loved what their organization is doing to elevate the status of the workers that need to, they're last responders, right? The ones who are emptying these latrines, making them safe, making them clean, and showing people that is actually a skilled position.
Mm-hmm.
Right.
And, these are people that deserve our respect and that there's a real art to it, skill. I thought that was really, really inspiring how their organization is taking that segment of the workforce and elevating them.
Well, it's great. They're taking such a global approach too.
Mm-hmm.
Yeah.
Well, and I mean, because that's how we're going to stop, disease and everything. I mean, it's really, really important. It's a really important skill to have.
Yeah. Another thing that we talked about, the non-sewered, what was it? Non-sewered solutions or non-sewered sanitation. Kind of an idea that's not super common in the States. The idea that there are other ways to get this job done. There are other systems that are just as effective, if not more effective.
Yep.
I thought was really insightful and important for us to be more aware of.
Yeah, we loved that when we saw them at the World Toilet Summit, they were just taking a global approach and using the latest technology.
Right.
They're just doing a great job.
Yeah. So thank you to Jennifer for sitting down with us. And thank you to you guys for joining us. Please like, share, and subscribe. We are so happy with the listeners that join us every week. And go check out the marketplace. We're getting cool new products on there all the time. We've got some really interesting things coming up that we think you're going to like, especially the
Poo-Dough, some Who Gives a Crap toilet paper to clean it up.
So cute. Yeah. All right, you guys. Thank you so much.
Thank you for listening to the ZuLoo Poodcast. Follow us on social media at our links in the show notes below. To learn more, visit our website, ZuLoo.org. If you liked the podcast, be sure to subscribe, like, and comment. For even more ZuLoo fun, send us an email with your toilet stories to podcast@ZuLoo.com for a chance to be featured on the podcast. This episode of the ZuLoo Poodcast is sponsored by ZuLoo Inc., a benefit corporation dedicated to the goal of universal access to toilets, hygiene, clean water and sanitation through the power of social enterprise. Learn more at ZuLoo.com.